The alcohol and brain damage. Alcohol is a CNS depressant, mainly increasing the activity of the GABA A type of receptors, which is an inhibitory receptor. It inhibits the activity of NMDA type of glutamate receptors, which is an excitatory receptor and produces excitatory neurotransmitters. But in chronic alcoholics, because of the downregulation of GABA receptors and upregulation of glutamate receptors, the situation becomes reversed and a person becomes hyperactive. Because of the tolerance and because of the withdrawal, the person becomes hyperactive. There are three types of tolerance or compensation. Number one, metabolic or pharmacological tolerance, and that develops after 1 to 2 weeks of daily drinking and is due to 30% increase of hepatic ethanol metabolism. Number two, cellular or pharmacodynamic tolerance contribute to physical dependence. And number three, the person adapt their behavior or a behavioral adaptation or tolerance. Also, in a withdrawal or tolerance, there is a stress, and that leads to increased CRF production that causes damage to the hippocampus. 1 to 2 drinks a day has some beneficial effects, but a higher dose alcohol is toxic to most systems in the body. So what are the structures damaged by alcohol? Are cerebral cortex, cerebellum, hippocampus, corpus callosum, thalamus, hypothalamus, and mammillary body ataxia due to the involvement of the cerebellum and vestibular system. The other symptoms in Vernix encephalopathy is stupor, low blood pressure, increased heart rate, as well as hypothermia, epileptic seizure, and a progressive loss of hearing. Number three, the mental changes in Vernix encephalopathy are dementia. These symptoms range from confusion, apathy, inability to concentrate, and disorientation, coma, or death. The classical triad of symptoms may be absent at first diagnosis of Vernix encephalopathy. The Korsakoff Syndrome. Korsakoff Syndrome is an acute onset of severe memory impairment without any dysfunction in intellectual abilities. The clinical features are anterograde amnesia and retrograde amnesia, and one of the following: aphasia, apraxia, agnosia, and a deficit in executive functions. The amnesia must be caused by the use of alcohol and without the evidence of delirium, intoxication, or withdrawal. Korsakoff syndrome is also caused by a thiamine deficiency due to stomach cancer, anorexia nervosa, and gastrectomy. Vernix-Korsakoff syndrome cognitive symptoms are insomnia, anxiety, difficulties in concentration, loss of memory for the immediate past, and gradual degeneration of the mental state consisting of confusion, confabulation, and hallucination. The confabulation, there is fabricated stories made by the patient. Critical structures that lead to memory impairment in Vernix-Korsakoff syndrome are the atrophy in the structures of the diencephalon, namely thalamus, hypothalamus, and mammillary bodies. The brain atrophy associated with this syndrome occurs in the following region of the brain: the mammillary body, thalamus, periaqueductal gray matter, the wall of the third ventricle and the fourth floor of the fourth ventricle, cerebellum, frontal lobe cortex. The amnesia that is associated with this syndrome is a result of Vernix encephalopathy due to vitamin B1 deficiency. The Vernix-Korsakoff syndrome is also found in patients who undergo prolonged IV therapy without vitamin B1 supplementation, gastric stapling, in ICU stays or hunger strikes, and patients who take polished rice. In them it is called beriberi. Fibrillation is commonly associated with chronic alcoholism, but it may also result from dietary deficiencies, craniocerebral trauma, neoplasm, cerebrovascular disorders, encephalitis, epilepsy, and other conditions. The psychiatric disorders and alcoholics. Anxiety, it occurs in 10 to 30% of alcoholics during withdrawal and persists for many months after cessation of drinking. Number two, sadness is common. Sadness or depression is common in chronic alcoholics, lasting 4 days to 2 weeks in heavy drinkers. Alcohol-induced psychotic disorders, auditory hallucinations, and paranoid delusions are common. Alcoholics have cognitive problems and impairment in recent and remote memory. Permanent CNS impairment, alcohol-induced dementia occurs in 20% of chronically demented patients. The B1 deficiency, that is the cause of all this defect, causes damage to the medial thalamic nuclei and mammillary bodies. That atrophy of these structures may be visible on MRI. The other defect that alcohol causes is hypothermia, because it damages the hypothalamus. The core temperature goes below 35 degrees Celsius or 95 degrees Fahrenheit. It occurs in winter but is also common in summer and common in extremes of ages, neonates and elderly. Neonates have higher rates of heat loss because of the increased surface to mass ratio and their lack of effective shivering and adaptive behavior response, and in malnutrition due to diminished subcutaneous fat. Ethanol causes vasodilatation, which increases the heat loss, reduces thermogenesis and gluconeogenesis, and impairment in judgment or lead to obturations. The drugs that cause hypothermia are phenothiazines, barbiturates, benzodiazepines, cyclic antidepressants. Anesthetic blocks the shivering response. The endocrine disorders that cause hypothermia are hypothyroidism, adrenal insufficiency or Addison disease, hypopituitarism, and hypoglycemia. So why thiamine deficiency occurs in chronic alcoholics? Alcohol interferes with absorption of vitamin in a small intestine and decreases its storage in the liver. It also decreases folic acid, vitamin B6, niacin, that is vitamin B3, and vitamin A. Heavy drinking can also produce low blood levels of potassium, magnesium, calcium, zinc, and phosphorus, and causes acid-base imbalance. Alcoholic ketoacidosis shows an increase in serum ketones along with a mild increase in glucose. This is the differentiation with the diabetic ketoacidosis. Alcohol in a fasting healthy individual produces hypoglycemia within 6 to 36 hours, secondary to acute actions of ethanol on gluconeogenesis, and leads to behavioral, motor, and cognitive changes that are seen at 20 to 30 milligram per 100 ml, and that occurs after 1 to 2 drinks. The death occurs at 300 to 400 milligram per 100 ml. Beverage alcohol is responsible for more overdose death than any other drugs.